This is the presentation number 5 for radiological anatomy of the brain, prepared by Sharaf and revised by Rami. Here we have a test for what we have been taught before, the superior temporal gyrus. We now know that this temporal lobe is divided into superior, middle, and inferior temporal gyri. Here the lesion is lying at the superior temporal gyrus, just below the sylvian fissure. This is an anterior and middle opercula, and here is the middle temporal gyrus. Of course, this is a hematoma. Middle temporal gyrus. This is the superior temporal gyrus, the middle temporal gyrus, and this is the inferior temporal gyrus. Here the lesion, as we said before, that this temporal lobe is divided by the superior into superior, middle, and posterior temporal and the inferior temporal gyri. The lesion here is involving the inferior temporal gyrus near to the cerebellum. And in axial views we have the appearance that it is seen in the posterior opercular region, anterior, middle, and posterior opercular region. Now here the Hessel gyrus, and Hessel gyrus is the one just parallel and just posterior to the sylvian fissure, parallel and posterior to the sylvian fissure. Here it is. It is just as if like something in close relation, following the same line as the sylvian fissure. It is concerned with primary auditory area, and if this is the sylvian fissure, it is just the one above. So it is above and posterior. The one above and posterior, the sylvian fissure, is the Hessel's gyrus, which is responsible for the primary auditory function. Here we can find an AVM just posterior and just superior to the sylvian fissure, region of the sylvian fissure, just superior, just posterior. This is the auditory area, Hessel's gyrus. Now what about the occipital lobe? To continue, we have finished parietal, temporal, and now we have the occipital. Frontal, we have finished frontal also. The occipital is limited by two main fissures. The parieto-occipital, this is the one, parieto-occipital fissure, which separates the parietal from the occipital. This is number one. Number two, that the occipital lobe is resting on the cerebellum, and that medially there is a perpendicular line to this sulcus, like that way, but it is medial. It's called the calcarine fissure, and is responsible for the visual area. So we have two main facts. One is the sulcus separating the parietal from the occipital. It's called the parieto-occipital fissure, and that it is resting on the cerebellum. And of course, as you see, it is the most far posterior part of the brain, and it's on no more than 1/5 of the whole brain size in longitudinal direction. Medially, as I said, if this is the parieto-occipital, the main fissure separating the occipital from the parietal. Imagine a perpendicular line on it, and this will be the calcarine sulcus. The area around the calcarine sulcus is the area responsible for the primary visual area. Now, we have to know something about fasciculi. A fasciculus is the group of fibers connecting one gyrus to another. If it is nearby, they are called arcuate fibers or U-shaped fibers. If it is away, it is called fasciculus. This is the frontal lobe, this is the parietal lobe, and this is the central sulcus. This is the parieto-occipital fissure, and this is the occipital lobes, most posterior. And if you draw a line obliquely about 15 degrees from the horizontal, starting from the region of the corpus callosum splenium up posteriorly, you will pass eventually in the parieto-occipital sulcus. Now, what is SMG? SMG means the supramarginal gyrus, and AG means angular gyrus. This is important because it is the most posterior part of the parietal lobe. It's called the angular gyrus. Now here, the lesion is posterior to the occipital horns. The lesion is on the left. The lesion is more posterior than the parieto-occipital sulcus. Thus, it is in the occipital lobe and proved to be astrocytoma. A fasciculus, another fasciculus, is joining vernix area with the Broca's area. Broca's is the frontal, while vernix is the temporal, and they are responsible for the memory and speech. Now here, this is the region where the Broca's area is there, and this is the region where the vernix area is there, and this is the fasciculus coming from here backward here, and it is seen in the sagittal end as an arcuate line. This is parietal, this is occipital, because this is the parieto-occipital sulcus on either side, or fissure. Thank you.